Good morning. I'm Mark Hurt. I'm the acting chief medical officer at Myrtelle. Myrtelle is named for Myrtle Canavan, and she was a neuropathologist at Harvard who first described Canavan disease. I'm going to talk to you today about MYR-101 and its effects on subjects with Canavan disease in a clinical trial. All 8 subjects are now past their 1-year time point, and I'll present the preliminary data for them. So Canavan disease is a lethal brain disorder. It's an autosomal dominant defect in ASPA, which encodes aspartoacylase. There's about 1,000 patients in the United States and 5,000 patients worldwide who are affected. And these children do not develop motor function or cognitive function. They can't sit, crawl, stand, feed themselves. No treatment is available, and they have early death. Most of these kids are running into other medical problems, complications by the time they hit the age of 10, and don't live longer than that. Our strategy is simple, as it is for most gene replacements. We want to correct the underlying gene defect. We want to restore function in oligodendrocytes. Those are the cells in the brain that are responsible for myelination of the white matter, and improve the kid's function. So in the left lower part of the slide, you see that there's a cartoon that is our gene map, and that gene enters oligodendrocytes, turns on good copies of ASPA, and when good copies of ASPA are present, the oligodendrocytes begin to function and make myelin. In the phase 1-2 study, I'll refer to this as our FIH study, we have 8 patients. They range in age from 11 months to 59 months. They're all treated with intracerebroventricular gene therapy with MYR-101. The long name for the vector is on the slide. And the dose is 3.7 × 10^13. I'm going to show you results in the following order. I'll show you the results for volumetric MRI, for white matter, and for myelin. I'm going to show you comparisons to baseline for the Mullen scales of early learning. There are 5 domains. And then a comparison to the natural history for the Mullen scales. And then some MRI images and video recordings of a single subject as an exemplar. And then we'll finish up with a slide about safety and tolerability. On the left panel, you see plotted the change from baseline in the white matter volume on the y-axis, and then on the x-axis is time. And here we're showing you how much the white matter changes. So by 6 months, the white matter is up, and it stays up at 12 months. And the left panel is an observed case analysis. The right panel is last observation carried forward. And you can see that both analyses give us statistically significant increases in white matter. This same pattern of graphs you're going to see on the next several slides, so it's just going to carry through. I'll tell you what's on the x-axis each time, but I'm not going to go through the whole rigmarole of how things are plotted out. So this is white matter. Next is myelin volume. So first thing that happens is that myelin volume is increasing. The next thing that follows that is myelin increasing. And now I'm switching to developmental scales. So this slide shows you the mean developmental age across the the Mullen scale domains. And the change from baseline is shown on the y-axis. And again, there is an increase in the developmental age as time goes on. It's first evident at 6 months, and then it hangs in there at 12 months, and still increasing. The same is true for the gross motor domain. So this is one of the 5 Mullen domains. And you see that at 6 and 12 months, when we are doing an observed case analysis, we're not yet statistically significant. When we do an LOCF, we knock the socks off it. Same thing is true for receptive language. And the same thing is true for expressive language. So we're knocking the ball out of the park on 3 out of the 5 Mullen domains. And then I want to show you, for the first time, we're able to compare our results to natural history. So we have 8 subjects. All of the subjects have a visit between 11 and 59 months. So that visit matches the baseline visit for the first-in-human subjects. And then they have another visit at 10 to 14 months. We're going to plot that at 12. And you see that for the five domain mean, we're also knocking it out of the park compared to the natural history subjects. And this is also true for the gross motor score. So not only are we seeing improvements compared to baseline, but we're seeing improvements compared to 8 natural history subjects. This is an MRI of one of the subjects in the trial. And on the left panel, shaded in green, you see a pseudocolor image where myelin is represented as green and really intense myelin is represented as yellow. On the right panel, you see the same scan level, but now the pseudocolor is white, and that's meant to show white matter. There's a time course here. On the extreme left, what you see is the baseline scan. Then to the right of that, you see the 12-month scan. You see that the myelin signal is increasing because you see yellow and you see an expansion of the area of the green. Same thing is happening with the myelin scan, but it's a little bit less evident at this level. So I'm going to show you lower levels and show you how much myelin and white matter sort of overlap. This is at the level of the midbrain through the red nucleus. On the extreme left, you can see that at baseline there's myelin in the cerebral peduncles and there's myelin in the temporal lobes. By the time you get to 12 months, that myelin has expanded in the midbrain and it has expanded in the temporal lobes, and now it's reaching into the occipital lobes. And the same thing is true for the 2 slides on the right, where you see that myelin was present at baseline, but now it has expanded quite a bit into the temporal lobes and occipital lobes. I have one more set to show you. This is through the medulla and the dentate nucleus of the cerebellum. On the extreme left, you see the dentate lighting up. To the right of that, at 12 months, the medulla is lighting up and the cerebellar hemispheres are lighting up. And the same pattern is seen in the myelin scans to the right of that. This is a video recording of that same child. So at baseline, he's floppy, does not have head control. And this is a typical finding in children with Canavan disease. At month 3, he's a happy camper. He's not quite able to stand up by himself. He's getting a little bit of assistance with that, but his head control is excellent, and he's learning to bear weight and control his trunk. At 6 months, he's getting help with stability at the hip, but he's able to extend and stand, and he's still a very, very happy kid. And at 12 months, he's now sitting unassisted, and his fine motor skills have improved to the point where he can play with pants. And you can see that he's no longer got his hand balled up in a fist. He's able to open it up and do things with it. And then finally, at 12 months, he's shown here, there we go. He is shown using a walker while he's in physical therapy. Last, we have a strong safety profile. We haven't had any serious adverse events that are attributed to the procedure or study drug. We've had 2 non-serious adverse events that were reported that were possibly related to study drug. One was a fever, and the other one was a rash that resolved the same day. A table of the serious adverse events is on the slide. But again, none of this is attributable to the procedure or to the gene therapy itself. I want to thank the parents and families who participated in the trial, and I want to thank the co-principal investigators and the site staff at Dayton Children's Hospital. I will take questions if you have them. And if you have a question, step to the middle aisle where there is a microphone for you to use. Okay, thanks. I think you're going to get some time back. Have a good day.